2020-2021 by conveyance variants of SARS-CoV-2 vaccines by country. SARS-CoV-2 Delta variant, also known as lineage B1.617.2, is a variant of lineage B1.617 of SARS-CoV-2, the virus that causes COVID-19. It was first detected in India in late 2020. The World Health Organization named it the Delta variant on the 31st of May 2021. It has mutations in the gene encoding the SARS-CoV-2 spike protein causing the substitutions T478K, P681R and L452R, which are known to affect transmissibility of the virus as well as whether it can be neutralized by antibodies for previously circulating variants of the COVID-19 virus. In May 2021, Public Health England observed secondary attack rates to be 51 to 67% higher than the Alpha variant. COVID-19 vaccines are effective in preventing severe disease or hospitalization from infection with the variant. Some evidence suggests vaccinated people are more likely to develop symptoms from Delta than other variants of SARS-CoV-2. On the 7th of May 2021, FI changed their classification of lineage B1.617.2 from a variant under investigation. The UK's SAGE subsequently estimated a realistic possibility of being 50% more transmissible. On the 11th of May 2021, the WHO also classified this lineage VOC and said that it showed evidence of higher transmissibility and reduced neutralization. On the 15th of June 2021, the Centers for Disease Control and Prevention declared Delta a variant of concern. The variant is thought to be partly responsible for India's second wave of the pandemic beginning in February 2021. It later contributed to a third wave in Fiji, the United Kingdom and South Africa, and the WHO warned in July 2021 it could have a similar effect elsewhere in Europe and Africa. By late July it had also driven an increase in daily infections in parts of Asia, the United States, and Australia. As of the 20th of July 2021, the variant had spread to 124 countries, and WHO indicated that if it were not already the dominant strain that it was becoming the dominant strain globally. The Delta variant has mutations in the gene encoding the SARS-CoV-2 spike protein causing the substitutions D614G, T478K, P681R and L452R. It is identified as the 21A clade under the next strain phylogenetic classification system. At the end of May 2021, the WHO assigned the label Delta to lineage B1.617.2 after introducing a new policy of using Greek letters for variants of concern and variants of interest. There are 3 sublineages of lineage B1.617 categorized so far. B.1.617.1 was designated a variant under investigation in April 2021 by Public Health England. Later in April 2021, 2 other variants B1.617.2 and B1.617.3 were designated as variants under investigation. While B1.617.3 shares the L452R and E484Q mutations found in B1.617.1, B.1.617.2 lacks the E484Q mutation. B.1.617.2 has the T478K mutation, not found in B1.617.1 and B1.617.3. Simultaneously, the ECDC released a brief maintaining all 3 sublineages of B1.617 as VOI, estimating that a greater understanding of the risks related to these B1.617 lineages is needed before any modification of current measures can be considered. Amino acid mutations of SARS-CoV-2 Delta variant plotted on a genome map of SARS-CoV-2 with a focus on spike. The Delta B1.617.2 genome has 13 mutations which produce alterations in the amino acid sequences of the proteins it encodes. 4 of them, all of which are in the virus's spike protein code, are of particular concern. The E484Q mutation is not present in the B1.617.2 genome. Delta with K417N corresponds to lineages I.1 and I.2 and has been nicknamed Delta Plus or Nepal variant. It has the K417N mutation which is also present in the beta variant. The exchange at position 417 is a lysine to asparagine substitution. As of the 15th of July 2021, the I.3 variant accounted for approximately 21% of cases in the United States. The most common symptoms may have changed from the most common symptoms previously associated with standard COVID-19. Infected people may mistake the symptoms for a bad cold and not realize they need to isolate. Common symptoms reported have been headaches, sore throat, a runny nose or a fever. In the United Kingdom, where the Delta variant makes up 91% of new cases, one study found that the most reported symptoms were headache, sore throat, and runny nose. Way reduces less than 10%, or way greater than 90% without comparator. Way reduces between 10 to less than 20%. Way reduces between 20 to less than 30%. Neutralization reduces less than 2-fold. Neutralization reduces 2 to less than 5-fold. Neutralization reduces 5 to less than 10-fold. Neutralization reduces is greater than or equal to 10-fold. WHO hasn't issued preventative measures against Delta specifically. Non-pharmaceutical measures recommended to prevent wild-type COVID-19 should still be effective. These would include washing hands, wearing a mask, maintaining distance from others, avoiding touching the mouth, nose or eyes, avoiding crowded indoor spaces with poor ventilation especially where people are talking. Going to get tested if one devil